confirmed cases have risen to 948 cases, still as we're counting from January 2017. Of these 948 cases, we've been able to trace 659 patients, and unfortunately, 180 of them have demised. It means the case fatality rate of this Listeria outbreak is 27%, because 180 people died out of the 659 that have been traced. In our constant search for the source of the outbreak and the treatment of people who are affected, a team from the NICD has interviewed 109 ill patients to obtain details about the food they have eaten in the last month before falling ill. 93 of them, that means 85% of these people, reported eating ready-to-eat processed meat products, of which polony was the most common, followed by Viennas and sausages, as well as other cold meats. On Friday, the 12th of January, 9 children under the age of 5 years presented to Chris Hani Baragwanath Hospital in Soweto with febrile gastroenteritis. The pediatrician suspected foodborne disease, including listeriosis, as the possible cause of their illness. The environmental health practitioners were informed, and on the same day, they visited that crèche, which is situated in Soweto, and obtained samples from 2 unrelated polony brands manufactured by Enterprise and the Rainbow Chicken Limited, respectively, and submitted this to the laboratory for testing. Listeria monocytogenes was isolated from stool collected from one of the ill children and from both the polony specimens collected from the crèche. These isolates were sent to the National Institute of Communicable Diseases, their Center for Enteric Disease, and underwent whole genome sequencing and genomic analysis. The ST6 sequence type was confirmed on all 3 isolates on Saturday, the 27th of January. I wish to remind you that in our last briefing, I informed you that clinical isolates which were obtained from patients indicated 9 sequence types, or what is called LST types, of Listeria monocytogenes, and 91% of those were found to be ST6. You will then remember that we concluded that this outbreak strain, this outbreak is driven by a strain called ST6. And we said to search for the source, we must find the ST6 in the patient and the food and the factory. And I also wish to remind you, we took a decision then after the last press briefing that we will visit all the food processing sites, food packaging sites, as well as food production sites where possible. Now, following the lead from the test performed from these children from Soweto and the food they've ingested, the environmental health practitioners, together with staff from the National Institute of Communicable Disease and staff from the Department of Agriculture, Forestry and Fisheries, accompanied by 3 technical advisors from the World Health Organization in Geneva, visited a food production site in Polokwane and conducted an extensive food product and environmental sampling. The food production site in Polokwane was visited because as we're tracing the polony that these kids have ingested, it pointed to that production site in Polokwane. Listeria monocytogenes was isolated from over 30% of the environmental samples that were collected from this site, which happens to be the Enterprise factory in Polokwane. To conclude the investigation, whole genome sequencing analysis was performed from this Enterprise factory, and the results became available midnight last night. The reason that I called you here is because the NICD woke me at 12 o'clock last night and told me that they've got results from the enterprise facility and that the outbreak strain, ST6, has been confirmed in at least 16 environmental samples that were collected from this site. We can now conclude scientifically from what I've just told you that the source of the present outbreak is the enterprise food production facility located in Polokwane. Additionally, preliminary results show that several ready-to-eat processed meat products from enterprise facility located in Germiston contain Listeria monocytogenes, but the sequence type is not yet known. So not to confuse you, the enterprise factory in Polokwane has got Listeria monocytogenes and is the outbreak strain, is the ST6. That was confirmed by midnight. But the enterprise laboratory in Germiston, Listeria has been found, but we have not yet time to do sequence typing. We could not wait, and I'm sure you'll understand why we could not wait for that one, because we believe the fact that we got one in Polokwane is enough for us to start taking action and warning the public. Investigation of the Rainbow Chicken Limited Volvel Hook production facility is also underway. We also investigating there. Poloni products have tested positive for Listeria monocytogenes, but the sequence type or the STD type of the isolate are not yet known. So in other words, another laboratory where Poloni products were tested is the Rainbow Chicken Laboratory in Volvel Hook. I think it's in the Free State. It's in Sasolburg, yes, in the Free State. But we are not yet having the sequence type. We did not want to wait for that, but the sequence is underway. However, such contamination of ready-to-eat processed meat product constitute a health risk. Also, over 10% of environmental samples collected by environmental health practitioners at this Sasolburg site have tested positive for Listeria monocytogenes. We are still waiting, as I said, for the sequence type. With information at our disposal, we have decided on the following course of action. One, the National Consumer Commission has, in terms of Section 60, subsection 2 of the Consumer Protection Act, this morning issued the manufacturers concerned with safety recall notices. Section 60, subsection 2 of the Consumer Protection Act states that if the National Consumer Commission has reasonable grounds to believe that any goods may be unsafe or that there's a potential risk to the public of the continued use or exposure to the goods and the product, or or the importer of this good has not taken any steps required by an applicable code contemplated in subsection of the Commission by written notice, may require that, number A, conduct an investigation contemplated in subsection 1, or carry out a recall program on any terms required by the Commission. The NCC will prepare a recall strategy in conjunction with the manufacturers and make further announcements to the public in due course. The safety recall will affect manufacturers' entire production networks, both domestic and international. In other words, when this recall is going to be made, we'll recall all the products distributed locally and internationally. Number 2, compliance notices will be issued to facilities in terms of the National Health Act. Environmental health practitioners appointed in terms of Section 80, subsection 1 of the Act and duly registered as such in terms of Section 83, subsection 5 of the National Health Amendment Act 2013, Act number 12 of 2013, should, upon finding that there are terms of Section 83, subsection 1 and 2 existing conditions, which A, constitute a violation of the right contained in the Section 24A of the Constitution, B, constitute pollution detrimental to health, C, is likely to cause a health nuisance, or D, constitute a health nuisance. The action number 3 that we are taking, in terms of registration for exports by the Department of Agriculture, Forestry and Fisheries, the respective processing or manufacturing establishment, namely the Rainbow Chicken Limited Foods with an export registration number ZA32, and the Enterprise Foods with an export registration. Excuse me, let me read this sentence again, I'm sorry. Sorry, pardon me. In terms of registration for exports by the Department of Agriculture, Forestry and Fishery, the respective processing or manufacturing establishment, namely the Rainbow Chicken Limited, is trading as RCL, but I believe it means Rainbow Chicken Limited Foods, with an export registration number ZA32, and the Enterprise Foods in Polokwane, with an export registration number ZA33, have been temporarily suspended till further notice. I'm sure it's clear now. We advise members of the public to avoid all processed meat products that are sold as ready to eat. While we know that polony is definitely implicated, there is a risk of cross-contamination of other ready-to-eat processed meat products, either at production or distribution or at retail. This is because Listeria monocytogenes on the exterior casings, that means packaging of polony, can be transferred to other products it comes into contact with, including Viennas, Russians, Frankfurters, other sausages, and other cold meat products that are typically not cooked before eating. I think I need to explain this. When our search team visited retail sites, they found that these products are packed together, whether it's from Enterprise or RCL, from other manufacturers which I have not mentioned. They pack them together. And because Listeria was found on the exterior casing, they contaminate each other. So the conclusion we can reach is that, unfortunately, any of those ready-to-eat products, like Viennas, Frankfurters, Russians, and other sausages, even from the companies where there's no recall, must be avoided, unfortunately. The recall is for Rainbow Chicken Limited and Enterprise only. There we are doing a direct recall in terms of the respective legislation I've mentioned, but we are only members of the public. To be on the safe side, because that contamination was found, we just have to avoid all these things, and I'm repeating them. Viennas, Russians, Frankfurters, other sausages, and other cold meat products that are typically not cooked before eating. Just a reminder that people who are at high risk, who must make sure that they avoid this product like plague, are pregnant women. They must not go anywhere next to these products I've mentioned. Neonates in the first 28 days of life, of course, they don't eat these products, but they get them from their mother directly. Elderly persons, those who are greater than 65 years of age, and anyone with a weakened immune system, either due to HIV infection, due to cancer, due to diabetes, due to chronic kidney disease, due to chronic liver disease, people with transplants, and those on immunosuppressive therapy, such as oral corticosteroid, people on chemotherapy or anti-NTF therapy for autoimmune disease. All these people must make sure that while others of you might take chances on this product, the people I've mentioned must just not go anywhere nearer them. The recall of these products does not mean that members of the public must now relax and stop the 5 food safety rules from the World Health Organization, which we have recited many times. They must never be abandoned. That means washing your hands before handling food or when coming from the bathroom, making sure that food is well cooked, making sure that you isolate raw food from cooked food, making sure that food is in appropriate temperatures, and washing uncooked food with clean running water, as well as using only pasteurized or boiled meat products. Those rules must still be adhered to. Don't say now the minister has announced that we know the source, and as long as I avoid that source, I can now not wash my hands. Please don't do that. So it means that the general status of hygiene of the population must still be maintained or be made a priority of society as a whole, and it must remain like that forever, regardless of the fact that we now know the source. Thank you very much.
Thank you, Minister. Colleagues, I'm going to call the Minister back to the podium to take questions. As you ask questions, please introduce who you are and which media organization you are coming from. We'll take questions in three questions in one round. We'll be guided by the number of questions that you are interested in. First questions? Yes, NCA. The minister is not. Can you be loud, please?
What kinds of tests are carried out in this process, and does he think that the standards in this production council dropped?
Just come again. What
kind of tests are carried out to reach the outcome that you had? What kind of testing process was carried out at this point? Does the minister believe that the standards at this production council dropped anywhere? That's why you were the affected ones. And louder. And the last one is, do these companies do any quality control? Are you aware of it?
Catherine, please introduce yourself.
Hi, I'm Catherine Charles from Times Live and Sunday Times. Just a question for the minister. Did the environmental health practitioners in Limpopo do their job? So it's up to local government to go to factories and do sampling. One can presume they weren't visiting that enterprise factory. And then the second question would be that the enterprise factory test, I mean, process meat has been suspected from the beginning. Did they test the raise their alarm, or was it totally the health workers here and at Barrow who raised the alarm?
did we what?
Did enterprise, did the factory itself test? Did industry look for themselves, or was it really WHO and the health department?
Yes, ma'am. Yes, you.
My name is Lynn, I'm from the Mail and Guardian. Could you just clarify the process of the recall? Have you officially advised the companies involved that they are the suspected, or they are the source of the outbreak, and that their goods will be recalled? And in that process, how does it work with the retailers who then sell all their goods on?
Thank you. Can we take just one more question before the minister can come back? SABC, no questions? Minister, please.
Yeah, unfortunately, all of us have to walk up and down. Yeah, yes, I forgot when I was, because I was in a hurry, when I was acknowledging guests, to introduce Professor Eric Book, who is the chairperson of the NHLS laboratories. As you know, NICD falls under that. And Dr. Kemicheti, who is the acting CEO of the National Health Laboratory Services. We are actually in their premises. I hope they won't drive us out for having forgotten to acknowledge them. The questions from Chona, the kind of testing, can I leave it to the experts? Dr. Juno Thomas, that's a question of expertise that's needed. Can you come over? She's asking what type of testing. I thought we have explained that in previous press conferences. But anyway, just to help, yeah. She said, what type of testing do we conduct? You mean on the different isolates? Yes. Maybe let me summarize as saying there are 3 tests here. It's either it's the clinical isolate, meaning blood or stools or whatever from the patient, or the food isolate, meaning you go to the fridge or wherever, where you get the food or from wherever it's found. And lastly, the environmental isolate, meaning you go to the factory, you don't take samples not only from the food, but you take it also from the surfaces in the environment. Now you want to know what test you conduct there, right? I think that's what she's going to answer.
So yes, the minister's answered very succinctly. And what we do is when the bacteria are isolated, either from the patient or from food itself, or from a food production environment, we then conduct the specialized genetic testing. It's a DNA fingerprinting called whole genome sequencing that allows us to compare the bacteria and ascertain with a great deal of precision whether they match exactly. So in that way, we can be certain that we have an outbreak strain in patients that are being ill and then match it to a food or food environment isolate. And it confirms if we have the presence of that outbreak strain in people who've got ill, as well as food that has been consumed by people who've got ill, as well as from the environment where that food is being produced. It's conclusive evidence of the source of the outbreak.
Okay, thank you. The next set of questions, whether the standards have dropped in those factories, whether they do quality control, and then and also including the question from Mail and Guardian, whether these companies have been officially informed of the recall and the relationship with the retail. I'll leave this to Mr. Lionel October, the Director General for Trade and Industry, and I'm not sure about the quality one, whether it belongs to agriculture, but I'll give them a chance. DG,
yes,
please.
Yes. So in terms of, I think, given the findings, it is clear that there has been a drop in the quality standards and in the manufacturing process. So that is the conclusion we've drawn. What has been done so far this morning after the results were received, we issued the 3 manufacturing facilities with a notice in terms of Section 62 of the National Consumer Act. Those facilities are the enterprise facilities in Polokwane and in Germiston, and then the RCL Volvohout facility in Sasolburg, Free State. Those are the 3 facilities. So they've received those notices this morning. The next step then is it is the responsibility of the company now to come up with a plan to recall all the products from those facilities. They will then meet with the National Consumer Commission, which we hope will be tomorrow morning, where they will then submit this plan for recall. The NCC and the companies concerned will then ensure that this plan is sufficient to cover the entire distribution chain to ensure that all these products are recalled, and then secondly also notices are then issued via the media to consumers as well who have purchased those products, what to do with those products that are already in their fridges and so on. So there's a proper recall strategy. It has been done on a number of occasions for different products. So there are set protocols in place for what constitutes a proper recall plan. It is the responsibilities of the companies then to put this plan into effect. to resource this plan and to pay for this plan, and they will then, the National Consumer Commission will ensure that this plan is implemented fully.
Catherine, the question you have asked, yes, is an important one and tricky, and I remember 2 weeks ago mentioning this to members of parliament, because we might have to change the constitution. The environmental practitioners, which in the past used to be called health inspectors, in terms of the new constitution from 1996, that function was taken from the Department of Health to municipalities. In other words, the environmental function of going to restaurants time and again, obtain food, isolate, send them to laboratory to check whether the food is healthy, to do generally the work done by people called health inspectors. The function was given by the Constitution to municipalities. And we have just realized that many municipalities don't really take that function seriously. Many of them are struggling to provide their basic functions like collecting refuse, making sure that there's clean running water, making sure that some people get housing, and etc. Many municipalities are struggling to do that. Now, for them, they believe hiring a so-called health inspector, they believe it's a Department of Health job. So they don't just do it. And the few environmental practitioners which we have who are working under the Department of Health, because they are not in municipalities, so they do work when required, but that job that was done in the past, in other words, before the new constitution, where they'll just move at random and send samples to the forensic laboratory services. Unfortunately, that is the one that is weak, and we believe in order for the departments of health in the provinces to hire them from the beginning, that part of the constitution will have to be amended and the function taken back to Department of Health. I believe the constitution believed, because it's, most of this work is done locally. If you give power to the local people or authority to the local people, it will happen. I've learned from experience now over many years that that does not necessarily happen. When you believe I'm giving authority to the bottom and the work will be done there, unfortunately, I've learned that also in a hard way when you compare the 1973 Mental Health Act and the 2002 Act about the powers at national and at the local level there. We realized that those things should not have been done like that, and they will have to be changed. So that's all I could say. But in the meantime, the few environmental practitioners under the Environmental Care Directorate, who are very few, will be running around the country to try and safeguard us. Yes, I think we have answered all the questions. Let's take a second round.
Yes, my sister, please introduce yourself.
Oh, yes.
Then
before that, who answered the question about whether enterprise is conducting tests? Is that correct? The answer. Whether enterprise itself is doing its own tests. Well, I mean, they go.
So companies have to conduct these tests as part of the normal production process. Of course, what we answered was, it is clear that there's been a break in these procedures. The testing, the quality process, but something happened in the entire chain, which allowed this food to be contaminated.
thank you. We'll take a second round of questions. Please introduce yourself.
My name is from Jacaranda FM. I don't know if I'm jumping the gun, but I want to know, obviously, this could have been avoided. People have died. What kind of measures will be put in place? Will these companies be fined? Who will be taking over from here? I know they will be conducting their own investigations as well. But from your side, where else is this going? And how are we going to make them accountable for what has happened?
Yes.
From the Field newspaper. I just wanted to make sure, how big is this recall of food? Is it the biggest in comparison to other foods that were removed or recalled before? And then, what other, will this factory and Polokwane minister, what will happen to them? Will they be fined, or
Another question?
Why do you mention only the one from Polokwane? Is it because I'm from there?
Shall we have another question for the Minister come? Colleagues, yes, Catherine, but I ask you not.
I think 1,500 food samples have been tested for listeria, and about 70 cases of listeria were found in those food samples, but they weren't the right strain. Does that mean we have a food safety problem, or is it normal to find 70 cases of listeria bacteria in 1,500 food samples?
Yeah. On that note, I'm going to ask the Minister to come back.
I suspect the first two questions belong to trade and industry. What do you do to companies if you find that something like this has happened? Yes. I'm sure we quoted several acts in here, but
yes. So, as I said, when the information was given to the Minister last night and you informed the Department of Trade and Industry and the National Consumer Commission, we then met this morning and received the results. So what the Minister outlined was the 3 immediate steps that have been taken. And the first step is the one which is in terms of the National Consumer Act, which all you need is reasonable grounds to believe that these facilities are putting consumers at risk. So with these 3 facilities, there is sufficient information at our disposal to say that these plants, these products coming from these plants must be recalled. So that is in terms of the National Consumer Act. So all it deals with is the recall program under this act. And it must be a total recall of all the products that have been issued. The next step is in terms of then the Health Act, where it is for the closing down of this facility is necessary. So what I understand is being conducted is that with the National Department of Health in conjunction with the municipality will be inspecting and investigating these 3 plants, and then depending on those findings they will actually do a complete closure of the plant, or they will put in place a certain process to ensure that proper food safety standards is implemented at these plants and so on. The third question about what are the rights in terms of then suing companies, they, as I said, that part will then be dealt with in terms of the law, which I think the civil law will apply, and companies will be liable for anything. But as far as the National Consumer Act, which is the one we immediately put into operation, there the only aspect dealt with is the recall.
I think she wants to know, is there any penalty from the Department of National Consumer Goods in the Act? You have already answered the issue of civil.
Yes.
Claim,
Okay.
but is there any...
I'll call the National Consumer Commission,
Yes.
Deputy Commissioner.
Okay. Start by introducing yourself.
My name is Tezi Mabuza. Thank you, Minister.
You make
And,
it look like a ghost.
and thank you, teacher. I didn't mean to, Minister. Colleagues, you asked in terms of the penalties and all that. In terms of the Consumer Protection Act, what normally happens is that when a supplier or a manufacturer or a distributor, they are all equally liable in terms of the distribution chain. But then, as you know, that they are supposed to periodically test in terms of quality and safety in terms of the goods themselves. If then it is being found that really they are liable, then it will be up to the consumer, again, as our DG has said, in terms of the civil law, again, to say that, yes, you have to really say that I ate this product, it is attached to this, and then there are tests that are conducted, then based on that, then you will follow the civil case, even if you are supposed to be really recalling the product. But then secondly, in terms of how far or is it the biggest? In this magnitude, we have done recalls before in terms of food safety, as you know previously. But then in terms of the magnitude and the complexity of this situation is that it touches on a plant, and a plant plant doesn't only produce, in this instance, only polony or maybe only some of this other product. You would find that in terms of the sauce or the carcass and all that, it touches a number of those. So hence now the recall protocol that the DG has spoken about, that then we will work with the companies to say, in the plant, what are you producing? What are the other foods? In terms of your own test again, what are other commodities that are being affected? So we would want them again to still go back and give us the assurance in terms of their own test. What are other products that might have been affected that have not been picked up by the routine tests? Then we can work with those. Thank you, DG.
I think the last question needs Dr. Juno again. The last question is that 1,000 or 50, did you say 1,500 foodstuffs have been tested, whether it's normal to find listeria in foodstuffs? I think that's what the question says, yes. Is it normal that, should we find 0 listeria in foodstuffs, or is there a percentage that could be found and regarded as normal? Come over. In other words, is it sterile? Should food be sterile like your blood, where you can't find even one bacteria?
Okay, so thank you. No, it depends on the kind of food that you're talking about. So for example, in raw chicken, it's very common to find listeria, and there aren't recommended limits for the permissible numbers of listeria in raw chicken generally. And that's because it's destined to be cooked before consumption anyway. You aren't going to have chicken sushi. So it is going to be cooked, and cooking very effectively kills off any listeria. It is foods that are typically going to be kept in the refrigerator for quite some time, because listeria grows and multiplies well at refrigerator temperatures. And then they also are foods that are typically going to be eaten as they are and not cooked any further. So outbreaks have commonly been linked to ready-to-eat processed meats for exactly this reason. Ready-to-eat processed meats also have a long shelf life, so anywhere up to 5 months. So the bacteria has a chance to multiply and proliferate in refrigerator temperatures. Also has been linked to multiple types of milk and dairy products, and in some cases, fresh and frozen produce. But there are permissible limits for certain kinds of foodstuffs for listeria. So like raw chicken, for example. But in ready-to-eat processed meats, ideally there should be none, because it does constitute a definite health risk.
Okay. Yeah, I think there's the answer. That in chicken is normally found, and generally people are never worried if they so do, because chicken is cooked. We get worried when we find them in foods that are not going to be cooked, like polony, etc., as you already said. I don't know, Bob, whether there are still any questions.
Just the size of the recall, how big is it?
Well, I'm sure the National Consumer Commission has already said it. Nobody knows. They are still going to sit with the respective companies, from what she said, find out from them that we found this in your polony or your Viennas. What other thing do you produce? Where do you send them to? In other words, you are going to let them come out and be honest. Because if they are not honest and they get caught, there will be consequences. And then from there you say, recall all these products. For instance, do you export to the neighboring countries? Where? Which ones? How much do you send? Can you recall all of those? Only then it will be quantified, and they will know. Otherwise, we'll be making a big guesswork, which will be a terrible mistake. And yes, I'm just being reminded that I must also mention that retailers will need to urgently clean their fridges, meat slicers, and daily areas thoroughly, and that if people have any ready-to-eat processed meats, especially polony, in their fridges, they must put them in a plastic bag, tie them tightly, and throw them away. I'm not sure whether the throw away part safe because there's going to be a recall. I don't know in terms of the consumer goods whether you are going to say the companies must refund people. But I must confess, I've already emptied my fridge this morning. Yes, it was full of polony, I don't know. And sausages, yes, definitely. Immediately, I was told last night, I woke up my wife, I said, I know, the fridge has got these things. Just take them out. Yes, I did. Oh, it was insider trading, yes. I got the information first. So I had to act first. So I didn't throw them away. I packed them, they are in a bag, and I put them in the fridge somewhere. You'll guide me. Maybe I'll throw money away if I throw them away. But jokes aside, any human being in this country who has got any of these products in their fridge, they must take them out completely. Yes, take them out completely, put them in a bag somewhere. If you have got a spare fridge where you can store them, do so. If you don't, just put them aside. I'm sure the Trade and Industry, the National Consumer Commission, and the companies will tell you immediately what must be done in the recall. Because I believe recall means they must go back to the factory, and I suspect it means a refund, not necessarily a penalty. Can you explain that, please?
Thank you, Minister. Colleagues, what normally happens when we have a recall, that's why we say we have a protocol with the company. We would call them like tomorrow, as early as tomorrow. What normally happens so that the public doesn't panic, as Minister has said, is to pack that product in, and then the companies will tell us exactly who are their distribution agencies or people that they normally sell to. And those would be the people wherein the products will be collected, because instead of using just a normal dumping, like you would do with a municipal dumping, it would create another hazard again. So with the strategy tomorrow, we'd work with those companies, make those modalities clear, but for now, all we are asking to the public is just pack them away, pack them safely, and then with the announcement, then you will be told exactly what to do with those products. Latest by tomorrow evening, then people would know. Thank you.
Yes.
Minister, the lunchbox and cartons and bottles and...
Yes, maybe for those who eat township style, there is something called spadlo. There is something called kota. They must just stop eating those things. Yes, because they are all packed with all these processed meats and all that. You know, some people eat it as their lunch boxes, or at break at school and all that. If you are used to eating spadlo and kota and all that, just wait a bit for now. That's the information we can give you. And maybe just to repeat this last information, because it's very important for the public. Number one, we are talking to retailers now. Any shop, small, big, or departmental stores or what, they need to take out these products, wait for that recall, as Consumer Commission has said, and then clean the fridges thoroughly. I presume, Dr. Juno, with warm water and soap is okay, because they don't have to sterilize them. With what? Please come. I don't want to make a mistake. If I remove this thing from my fridge, what do I clean it with? Because I can't sterilize it anyway. Yes.
So what we will do is post detailed advice on the NICD website, both for retailers as well as the general public, on how to effectively clean and disinfect fridges and other surfaces.
Yeah, but if I have to talk to people who have never even heard about the NICD, there are enough microphones here to inform them. What can I do even before your website?
Okay, so a very dilute bleach solution is in fact very effective, and that's what we would advise people to use.
They must dilute bleach and...
Yes.
Yeah, jig and all that.
By
the way, this is not new information. People know when there's cholera and typhoid, they drop a cap full of jig in water and all that. So they must just clean their fridges with jig and all that. And then those who are at home, who have got these products, I'm repeating, they must take them out of the fridge like I've done, follow my example, pack them, put them somewhere, wait for information about this recall, but also start cleaning the fridges thoroughly. Whether there's been an infection in the house or not, whether there's been a patient, they must just make sure that they clean them thoroughly. Yes.
Apologies, I'd just like to correct. The information will be posted on the NHLS website. Is that correct?
Not NHI.
Well, NHLS, NICD. It will be.
Okay.
And departments as well. Yes.
Yeah, yeah. Now, the last issue, which I thought you were going to ask, now that you didn't ask, yes, it might just be brought into attention. Maybe because I didn't remind you what we said last time, that 60% of these cases are in Gauteng, 13 are in Western Cape, 7 in KZN. But the main enterprise factory is in Polokwane. Yes. How does it connect? And the Free State, how does it connect? We never spoke about Limpopo and Free State in this thing. It's just a postulate from me. If you look at these ready-to-eat products, they are not products which rural people readily eat. The factory might be in Polokwane, but this is Gauteng food, you know. For all of you Gautengers, you're the ones here. Yes, I come from a rural area. In the morning, my breakfast is tea and bread, finish and clear. If you are lucky with some bit of jam. The Polonies, the Viennas, the sausages, you know what I mean. So that's why Gautengers are the ones who must open their eyes very closely. Because, yes, I'm talking to people there because people in Polokwane might be surprised how. They say this thing is here, but the sick people are in Gauteng. How does it come? It's, you know the type of food you eat. There you eat pap and morogo or pap and fleis, breakfast, tea and bread, and you stop there. So these other things are Gauteng or Western Cape and KZN, maybe around the Tekwini. So those are the people who must watch out. Thank you.
Minister, Dr. Kanan seemed to want to say something. After this, we'll take the last round of questions. Remember that the minister is available for one-on-one. I know that you guys prefer one-on-one questions.
Thanks, Popo. Thanks, Minister. My name's Kerrigan McCarthy. I'm the head of the Outbreak Response Unit at the NICD. Just wanted to add to my colleagues and to the Minister's presentation, there may be concern by members of the public who have consumed these products. And we would like to issue a reassurance that the vast majority of people who have consumed these products will in fact be fine. And that if any infection occurs in the vast majority of people, it is asymptomatic and there is absolutely no need to worry. The few persons who have consumed these products who have risk factors, as the Minister has pointed out, namely pregnant women, persons who are living with HIV, and persons who have other underlying immunocompetencies or immunodeficiencies. These persons, we have consulted with international experts and we have reviewed the literature, and the guidelines are that if someone has consumed these products and they have one of these underlying risk factors, but they do not have symptoms, in other words, they are presently well, that they should not be concerned. And if they are concerned, they may consult their general practitioner. The incidence of this disease is extremely rare, even in persons who have these underlying risk factors. And so, in the absence of symptoms, one should not worry. However, if one has consumed one of these products and one has developed a mild gastroenteritis or a febrile gastroenteritis, please consult your healthcare practitioner who may be able to do some tests and make an assessment as to whether you should receive investigations. We will be publishing notices on the National Institute for Communicable Diseases and the NHLS websites to advise healthcare workers how to handle these particular problems. Thank you. Gastroenteritis is diarrhea, so persons who develop a fever and diarrhea and have consumed these products should consult their healthcare practitioner. Thank you.
Yes, I presume people mustn't start getting sick because last night or this morning they ate some of these products we have mentioned. I'm sure the doctor there has explained what needs to be done. Dr. Chatora, the representative of the Health Organization, because when the enterprise factory was visited in Polokwane, we were lucky to be having 3 experts from Geneva. There was an expert in epidemiology, an expert in infectious disease control, and an expert in risk communication who went with our team to Polokwane. On Friday, Dr. Chatora asked them, if these results come out not indicating ST6, but we know that there's Listeria there, what do we do? And I think the World Organization gave him an answer on Friday. It will be important for him to inform us so that we know, because people spoke about standards here, whether we weigh ourselves against international standards. Doctor?
Thank you, Minister. Yeah, indeed, we have been working with the technical experts in the country on this investigation. And we are pleased that this is coming to conclusion, which is a big accolade, I think, to the experts that you have in the country. Indeed, we have been talking about, at each stage, with this information, what do you do? With this information, what do we do? And indeed, I sent an email on, it was on Friday, and I got a response yesterday, talking about what should the country be doing. And this was before the final results came up. The first thing is that the actions that need to be taken have to be consistent with the legal provisions in the country. Okay? So on the production plant, we thought that it was necessary to suspend production at the plant, and this is based on the following facts. First, from the plant inspection, the environmental swabbing indicated massive Listeria contamination. Then secondly, there was an epidemiological link between the plant and the cases that were in Soweto, you will remember. And now the whole genome sequencing that was done, the results which came last night, confirmed that indeed that is the source. So that's to do with plant production. The second is to do with recalling all products from the plant, all products. Because some would say, why are you not limiting to certain batches? The reason for recalling all products is because, one, the long duration of the outbreak. You remember the first cases we were told started from about January or February last year. And then secondly, as I said earlier, the massive environmental contamination across the different food production lines. So that's justification for taking this action, i.e. to recall all products from the market. As we were coming, we were told some of the journalists were asking questions about any linkage between this outbreak in South Africa and Listeriosis outbreak in Australia. Some of you might have heard about this. Australia has seen, since last month, 15 cases of Listeriosis, and 3 of these have died. They were able to identify the source as what's called rock melon. It's a type of watermelon which is farmed there in New South Wales in Australia. So they were able to identify the source, which was at a farm in New South Wales. And they have since put in place a trade level recall to recall all the rock melons. There is no evidence from the information that we have that these rock melons are exported to South Africa. And that lastly, the type of Listeria monocytogenes in this outbreak in Australia is ST240, which is, of course, different from the ST6 mainly that we were dealing with. So it's ST240. Thank you.
Thank you, Dr. Tishnell. Colleagues, I suppose we are going to end it here. The minister is going to be available for the live crossings that you might want to do and the one-on-one. On that note, being a Sunday, we thank you very, very much. I know that some of you responded at midnight as I was texting you to come and attend this, and I was wondering, why are you still awake? Journalists don't sleep. Thank you very much. We really, really appreciate it. The minister will also be lining up whoever that might want to. If Dr. Chitora, you want to speak to Dr. Chitora, we would be in a position to avail him. Thank you very much, colleagues. We really appreciate it.
Yeah, SABC, I'm sure you would like me to say something to the problem.
Sweet. Are you going to roll my cable up nicely for me?
Yeah.
Like the way I gave it to you?
I'm going to do that. You should.